All right. Well, welcome, Edgar, to Hygiene Elevated's podcast, Conversations and Innovations.
Well, thank you for having me.
We are super excited, Edgar. I think you're our first non dental professional that we've had on the podcast so far.
Correct.
So we're very excited to hear from you. You are Edgar Hurtado of NeuroMuscleWorks, and you are my massage therapist, but you are so much more than that. So I'm going to kind of turn it over to you to give us as much of an introduction of yourself and a little bit of your background as well. So you have the floor.
Awesome. Well, yeah, I feel very fortunate, and thank you guys again for having me. I think as healthcare providers, it helps a lot to learn from one another. Even
Mm-hmm.
just digging into your guys' podcast and learning a little bit more about dental hygiene and whatnot made me interested into looking into TMJ issues, which is so common in my field. And
Huge.
anytime I see an obstacle like that, or I guess something that most people have a hard time figuring out, it drives me into it. And I'm so stubborn, as I've told Amanda, if there's pain, there's got to be a reason or a factor behind it. Fortunately, that stubbornness and drive has gotten me to where I'm at now. I've been a massage therapist for almost 14 years now, so almost half of my lifetime. I went to UCMT, Utah College of Massage Therapy, back in 2010. And never did I think I was going to become a massage therapist. I don't think any kid really grows up wishing or wanting to be a massage therapist, but it just kind of landed on my lap. After high school, I went to college for about a year, hated it. I wanted to go into psychology, and I knew that was going to take a lot of time. But even back then, most people told me, "You're really good with your hands." I became pretty popular in high school with all the girls in front of me. And so I already had that sort of reputation. But even my mom would always ask me to work on her feet and stuff like that, and it just felt natural to me. So when people told me you should go to massage school, I kind of laughed it off. I was like, "That's a school? Like you have to go to school to massage people? Like don't you just do it?" So it really just feels like it landed on my lap. But if we dig deep enough, my great grandma was a healer, massage therapist, whatever you want to call her, back in our hometown in Mexico. And so there may be some connection there. I do vividly remember her grabbing me by my hands many, many years ago and seeing that I had calluses on them from working out. But little did she know it wasn't from working in the fields or working in the construction or anything like that. She never came to the States. She just saw my calluses and thought, "Oh man, poor kid, what's going on? Why does he have calluses?" But I told her, "Yeah, I work. I help my dad. I grew up in a farm, so I do value hard work and have some strong ethics behind hard work." But she grabbed my hands and said, "Well, these hands are here to serve." And it didn't really hit me until I was in massage school, where I was like, "Holy cow, I'm doing what my grandma did all her lifetime." Well, my great grandma, what she did for a whole lifetime. Maybe there's a calling behind this. And so every day I'm excited for work. I love meeting new patients. I love running into obstacles and hard cases. So it really is a driving force behind what I do. My kids love it because all my kids are athletes as well. They play soccer. One of them plays football, and the other one likes to jump on my back when I'm home because he's only 2 years old. So he's super active as well. But anytime they get injured or hurt, I work on them. But yeah, back in 2010, went to massage school. It was a really quick, trade uh, program. It took less than a year. I went there full time, and so right off the bat, I started working in a chiropractic office, and it was a struggle. The first couple of years as a male massage therapist, it's very difficult to get that sort of clientele build up and that reputation going. But a couple years later, I got into an internship with Real Salt Lake, the soccer team here in Salt Lake City. And from there, I never looked back. I've been working with athletes, from the fittest of the fittest to some of the greatest players in the world, to average 9 to 5 workers, dental hygienists, professionals in the field. And I love it. Every body that I get to work on teaches me something new for the next individual and the next person. And I take that as a huge advantage. People forget that this is a practice, and we got to practice it to figure out how we can resolve and help other people as we go along. But yeah, 14 years in the field, and every day I'm still learning. Like I said, just recently, this whole PMJ scenario came because of working with you, and also because I've had some patients that have complained about TMJ, and I just had to dive into it a little bit more to understand it.
Mm-hmm.
And I think I've hit some strides with that as well.
So many things that you just said right there. Like you nerded out, and that is perfectly acceptable for your field. That's like
Thank
a
you.
glimpse of like how we, whenever we talk to each other and we like have that conversation with somebody that's on that same wavelength, like, yeah, we'll nerd out about periodontal ligaments and biological
Yes.
widths and what have you. But you said something that kind of struck me as funny, not haha funny, but I think the same thing is true in dental hygiene. Male hygienists are the minority,
Mhm.
and still phenomenal, of course. I just had never even thought about a male massage therapist having that challenge to create a clientele for yourself. So that was very interesting. I hadn't thought about that
Yeah,
before.
no, it's
Listening to you speak, I thought, oh my gosh, I need to make an appointment. Like right now, I'm in love, but I have to come now.
5 minutes in. Let's go.
Joffrey's family does jujitsu, and your daughter is a gymnast. So they're all athletes. So they do need to see you.
My last patient today, he's been doing jujitsu for quite a while, and yep, I definitely see the need for it in that field or in that sport.
Yes. So as we're going to dive a little bit more into your career, first off, that story with your great grandma, like that was beautiful. Like the idea of these hands are for serving, like in hygiene, especially too, that's exactly our livelihood is our hands.
Right.
And that's how we treat our patients. And you, especially, like you have more tactile sensitivity than we do because you are just using your hands to feel so many things and so many layers of tissue, adipose tissue, muscle tissue, all of those things. You've been practicing 14 years. How would you describe what you do as different than like going to, not bashing anybody, but like a massage envy chain versus what you do? Because you're a pioneer in your field. I can attest to that as going through many, many massage therapists. And you are very different in how you approach problems, but how you treat problems. So go for it, Edgar.
Yeah, so I do believe there's a time and a place for all modalities, even a massage envy setting. I think is a great way to introduce somebody into massage.
Mm-hmm.
As far as what I do, I consider it to be more of an orthopedic type massage or more injury massage. But what I've dove into is more on the neurological perspective. So more working with the connection between the nerves and the muscles. In most massage therapists in the beginning, we're just working on muscles. We learn the anatomy. If somebody says my shoulders hurt, we work on the traps and the deltoids and whatnot. But what I guess makes me a little bit different is that I don't just want to work where it hurts. I want to work why it hurts. And I think that's a big issue even in our medical field where we're just treating the symptoms rather than fixing the actual problem or hitting the root cause. And so, and that's why I named my business NeuroMuscleWorks, because our muscles will be tight even without us asking them to be tight. And that's my main focus. I work on hypertonic muscles, which can develop over prolonged positions, sitting down for too long, or being in awkward postures for too long, or overusing them, or even underusing them, neglecting them. So if you think about it, there's no way of escaping it. We're going to have hypertonic muscles throughout our whole body. And that's my approach. I work on why things are hurting rather than where they're hurting. One thing that I always tell patients, I'm going to work where it hurts because you expect me to. I'm going to work everywhere else because I know better. And so we tie it all together where it's from head to toe. There's going to be, right now I have close to 100 or maybe even a little bit more now, 100 muscles that I could point out on any human anatomy, any human body. And I could already tell you this one's going to be weaker than the one on your left or vice versa. And that has come to me from doing so many assessments. So in my approach, I do manual resistant test. So it's basically like muscle testing, but I'm not necessarily looking to see how strong a muscle is. I just want to know if you're stable enough to hold that resistance. And when a muscle is hypertonic, it's already overworking, even when you're not asking it to work. So think of it like an outlet that has too much power coming out of it. At some point, it's just going to shut off. It's going to fuse out. So you got to go to the switchboard and flip it back on, right? So if there's too much power going out and we add a little bit more resistance on that test, it'll come off as weak. And so going back a couple steps down, there is what we call muscle activation. That's used by a lot of chiropractors. That's used by physical therapists. And it gets a lot of bad reputation from that perspective that it makes it sound like the muscle's off or not working. I switched that language to understand that it's actually overworking. By adding that test or that resistance, we can prove that because the muscle will just shut off in a way to protect yourself or as a defense mechanism. So what distinguished me from, let's say, a massage envy is that most places like that won't do an assessment. They'll just basically work where it hurts and it feels good. There's a lot of benefits and therapeutic benefits from that approach as well. But is it taking care of the root cause or the issue? Most likely not. And that's where we get stuck in the hamster wheel where we keep going back for the same issues and the same problems. With me, we actually scale it. Every session's a little bit different. It's rare when we have to work on the same muscles because the moment that we are able to restore functioning back into them, they just get better the more we go along. But there's so many muscles, just not enough time. I always tell people that. But with each session, it's a breakthrough each session.
Yeah, I can personally attest to that. And I finally, as Edgar knows, talked my husband into going.
Yep.
Like he had so much trauma in his back, and when I picked him up from your office, he was like, "That was so crazy." He did and he was describing the tests and everything, and he's like, "I should be able to throw him across the room, and I couldn't throw him across the room with my leg." And so he was honestly taken back. And I think one of the things that I appreciated about my session with you, that first session, was the education that you put into it and the visuals in helping to explain to me what's going on in my case, and then the visuals of what's going on, and then the communication of, hey, this is where I want the pressure point to be. I want you to be at an 8 and not above that, or a 7 and not above that. And so there was the whole experience was completely different when I went in, because I saw you initially for tingling that was going up my neck, and it's my left side, but you worked on my right side, and it was okay, I'm game for this. And that tingling in the neck hasn't come back, which is phenomenal to me. And so I've been an Edgar sellout ever since. But it's your method that had me coming back. Obviously you got to the root cause, but just the fact that it was so different than anything else I had experienced before, I was like, this guy knows his stuff really well, and is going to the next level. So I'm grateful as a hygienist that I have found you, but that you're doing what you are doing and being a pioneer in your field, because there's not just this drive, I think, in a lot of people to find that root cause, but to just get you on a regular recall, I guess.
Yeah.
So
I'll throw this in there.
Yeah.
I don't like to say that I fix people, even though people say oh, you fix this, you fix that. The body's doing the best it can with what it has. Most people have hypertonic muscles. My job is to just facilitate that and restore those tissues so that your body does better. Does that make sense?
Yes. Yeah, absolutely.
In my field, in my scope of practice, I can't necessarily diagnose anything. Everything I do is based off of a hypothesis, based off of the thousands of patients before you that have helped me formulate this approach. And when you say that I'm a pioneer in this, I do believe I am. And it's kind of scary and creepy to me because I'm I can't be the only one that has figured this stuff out. But I don't so much present a technique or a form of working. but I do feel like I could present a framework, a conceptual framework to how to treat these issues and how to work them. I do believe that almost any modality could help if we knew how to find the real issue. Does that make sense?
Yeah.
And so with what I feel like I present to the medical field and anybody that's listening, because I'm always willing to take on apprenticeships and therapists that are just starting out. What I feel like I could present to the world is that there is a neurological pattern to the human body. It's been so many years of me looking and searching if there's already something out there like this. I haven't found it yet. I'd love for somebody to reach out and say, yes, there is a pattern, so I don't have to work as hard to figure them out. But I also love that drive. I also love the challenges, and yeah, I'm excited to see what the future holds.
Edgar, I gotta back up here. You said you can't diagnose, and that just like resonated because Amanda and I can't diagnose anything either.
Right.
But
We can't diagnose.
Yeah, we spent years learning all of these things, and we can't diagnose. You said that, and I was like, oh my gosh,
Yeah.
me either.
Yet we treat people, of course, but not with a diagnosis, with that knowledge, that working knowledge of, if I have X and I do Y, I will more than likely get Z.
Yeah.
And yeah. So.
And I think diagnosing is the easy thing to do. Figuring out why it happens is the work part. So once again, like if you have tendinopathy, it's like, okay, cool, but why? Right. So that's where I don't necessarily work on the diagnosis or the problem or the pain, I guess. I work on the actual reason for why you're having that pain.
Well, and that's why I go to you.
Edgar, that's literally what the hygienists are doing too. Like, we'll identify somebody as being high risks for getting dental cavities. And our job is to figure out why. Why are you getting these so we can stop it from happening? Mm-hmm. Where the doctor is more like, okay, let's fix it. And then move on. But our job is more of like, why?
Right.
Yeah. We're the root cause people. We are like, I can help keep you from having to fix this if we can figure it out. So that is so many similarities here. But yeah, that's like, I think a drive for us is like that. Okay, let's figure out what either medical condition, lifestyle choice you're making that's causing this.
For sure.
So much of it.
That's so cool.
So kind of going back to your technique, neuroactivation, what is that for people who have never heard that term before? How would you describe that?
So anything that relates to the central nervous system, anything that can stimulate the central nervous system, that could be through trigger point, that could be through specific pressure points on the muscle, or even just certain exercises that can re-educate the tissues that you're trying to restore or work with. What I see in the field right now, which, like I said, most physical therapists do a lot of neuromuscular reteaching, neuromuscular reactivation through exercises. What I see right now is that we're doing it from a conscious perspective. It's very good when you can do the exercises when you have somebody cueing you to do it. But if you're doing, let's say, a sport where you're not having the time to cue yourself to properly throw a ball or how to properly squat when you're going in for a rebound or whatever, you want it to be more from a subconscious level. And I feel that massage therapists, we get so much time with the patient that we can address that more from a subconscious level. When we go back to that hypertonic muscle, I don't let go until it's done. And you've experienced this too. Yes. I don't move until I can physically and also intuitively feel that the muscle has released, and the patient can feel it as well. So going back to neuromuscle activation or neuromuscular approaches right now, we're doing it all from a conscious perspective. We're trying to reteach our body to do something from a conscious level, but as a massage therapist, from my approach, we want to get into the subconscious level, which is the hardest to get to, and it takes the longest as well. But I see it be more beneficial long term. I've seen cases from 6 years ago that the same muscles we've worked on are still on and rocking. They're feeling good. Where with physical therapy, at least in the standard physical therapy approach right now, as soon as you're done doing the physical therapy, you might go back to the same problem or a reoccurring issue, which, like I said, there's a time and a place for it. I see what I'm doing as the foundation. Physical therapy will even be 10 times better after that, if that makes any sense.
Yeah.
From my approach, it should be more from a subconscious level, teaching the muscles to respond even when you're not conscious of them doing motions. And working with athletes has gotten me to that level of understanding, because they do a lot of rehab as well after an injury. But most athletes, let's say they have an ankle sprain, they're more prone to have further issues like with the hamstrings or their hips or whatever. So I see that physical therapy is missing that aspect, that we want to start working with the subconscious before we work on the conscious.
That is like beyond next level. I mean, Joffrey, have you ever encountered, like, in any ergonomic course that you've taken or even heard of, like trying to get to a subconscious, like, perfect posture? Basically, that's one of the things that we're always striving for in hygiene is ergonomics. And we have a lot of equipment that helps us with that, but nothing to train us mentally. Have you?
No, I haven't. But I was so intrigued when to even learn about what neuroactivation was going to be. Edgar, I think we just tapped you into a new niche. There's going to be a ton of dental hygienists now. Like, teach us.
Yeah, I mean, I have the list of muscles that most likely every hygienist will be having a struggle with. It's just a matter of working on them. It's just a matter of restoring. My motto is release, restore, rise. So release, restore, rise, so that you can perform to your optimal level. Because I see it every day. I see, like I said in the beginning, when we do an assessment and you can't hold your leg steady, or whatever assessment we're doing, it almost seems like impossible. But once we work on it and retest it at the end, you're like, I couldn't do that before. Like your husband experience, as most patients experience, they're like, wait, how come I can do it now? Is this magic, or how did I get more strength? No, we just simply restored function back into that tissue to where you don't have to think about it as hard anymore. It just comes natural.
Yeah.
And I think we see that with toddlers. I think we see that a lot with younger kids. They have pretty good posture in comparison to an adult or a teenager. So I do feel that our natural ability is to have stability. Our stability is more related to our central nervous system, to our spinal cord. And that's why a baby might not have a lot of strength, but it has stability. It can protect its neck and protect its little torso whenever it's trying to roll over or you set them up on a desk. Most toddlers have pretty good posture, most babies. And so I do feel that we need to focus more on stability before strength, which right now in the industry, I think we focus so much on strengthening. Well, in my perspective, the more you try to out-strength a lack of stability, the more likelihood you're going to create compensations and eventually injury. So we want to fix the stability issue from that subconscious perspective, and posture improves. I've seen it all the time. I've seen people's posture improve a lot faster than forcing yourself to sit up straight every time, because we forget. Our body's going to go back to that habit if those muscles aren't performing to their optimal level.
There's a huge hot topic right now in dental hygiene, and I mean even within all of the medical field right now, but burnout, like physical burnout. Like there's definitely an emotional component to that, but I think a lot of it is physical too. Within my first year of practicing, I pinched my sciatic. And I mean, fortunately, I was young, so I was able to recover, and I probably didn't go about the best way of having it fixed, if you will. But that was a very serious injury very early on in my career that really kind of freaked me out. And I kind of tried to work a little bit more on my posture, without any sort of guidance from a professional such as yourself. But I think we need more of you in our field to help us physically be able to be present and not have those nagging aches at the end of the day that really wear on you. Because when your body hurts, like it really does wear on you mentally as well. So there's a huge factor there, I think, that could help with burnout in careers, any career.
Yeah, 100%. I agree. I work with a lot of young athletes as well. And so I'm excited for their future because I'm getting to catch these neurological inhibitions or hypertonic muscles at an early stage to where maybe they'll be able to play longer. You know, you see athletes like LeBron James and what's his name, Tom Brady. They're high maintenance. They have to get body work done every single day. I feel that if we did this approach, it would be less high maintenance. It would be more
Yeah.
restorative to where it doesn't, you don't have to overdo it to try to catch up from years of abuse and years of wear and tear. So yeah, I'm excited for the youth that I'm working with right now because I feel like this will prolong their careers. This will keep them from having early injuries. Because a thing about injuries is that tissues heal. You know, our bones will heal after several months. Soft tissue usually around 90 days it can fully heal, but our central nervous system doesn't forget, and it'll keep that information stored to avoid another injury from happening. So we never really reach that full recovery from a neurological perspective because we still have that fear of re-injury.
Mhm.
So with muscle activation or neuromuscle works, I feel that we can hit the reset button to where you now have that confidence again, and you're not so scared to re-injure the same tissues. And so, yeah, I do believe that more therapists should have this approach.
Yeah.
I think it's, like I said, revolutionary if it is something that I'm pioneering in. And yeah, it's humbling, but it's exciting at the same time.
Yeah, so Edgar, the last I do speaking for dental hygiene students prior to graduation, and
Mm.
at the end of the presentation, it turns into Q&A. And one of the students had asked me, she was a little concerned, like, "Hey, I've never done a full schedule before. Like, how do we prevent burnout when I've only seen like one patient a day? How do I handle a full schedule without hurting my body?" And I was like, "Well, my initial reaction to the or answer to that question was, is it the schedule's fault that your body's hurting, or is it your fault? Did you hold your instruments wrong? Did you have bad posture? Did you do something crazy to clean the teeth? Like, if your body's hurting, you probably need to just take it back to the basics and make sure you're using all those ergonomic tips and tricks that your um, educators and clinical instructors have been like instilling in you since day one. Like, if your body's hurting, it's likely your fault, not necessarily your schedules. And I'm not now. I'm like, oh, that was actually a really good answer after
Yeah.
hearing you talk. So
Sounds like such wisdom, Joffrey.
Well, especially with like working out, right? A lot of times I'll get patients in here that say, "Oh, I lifted wrong," or I have patients that say I slept wrong.
Hmm.
How do you sleep wrong? So it's all going back to the working out. I think working out should be used more as a diagnostic tool to know how healthy our body is feeling, rather than using symptoms as like, oh, something's broken, something's damaged. Don't wait for the symptom. Use working out as your measuring stick. Do I feel my age physically? Because we all have a chronological age, but we also have a biological age. A lot
Hmm.
of times people are a lot older biologically because of the lack of exercise or the lack of resistance training, but use the working out as a diagnostic tool to see like, oh, how does my body feel when I run a mile? How does my body feel when I try to lift 50 pounds versus 20 pounds? So use working out as that measuring stick rather than blaming the working out as the reason why you got injured. It'll expose these neurological inhibitions a lot sooner, which is great because I'd rather people come in when they're 20, 30, rather than when they're 60 or 70, because it's not harder to restore function, but there's that potential that there is some damage by that point.
Yeah.
The best way that I can explain that is that neurological inhibitions lead to postural distortions. And we can point out postural distortions in somebody's posture and the way they move, the way they live, but those postural distortions can lead to tissue danger, which equals pain. You can have danger that relates to pain. The reason why I say danger is because you could do an MRI or an X-ray and see that there's nothing broken, there's nothing torn. You just got to rest, right? That's what most doctors say. Just take a break, recover. But it's like, why do I hurt? That
Mm-hmm.
signal is related to the danger. Your body knows what's wrong. It's just trying to tell you through danger. But eventually that danger can become damage. So most times when you have damage to the tissues, you are going to have some pain as well. So neurological inhibitions lead to postural distortions, forward head carriage, rounded shoulders, hyperkyphotic spines, you name it. That leads to tissue danger, eventually damage, but they both equal pain.
I feel
So,
like he just called us out for all of our like shoulders and everything like that.
and that
Mhm.
took time, right? We obviously could, like I said, we can point that out. Is it an issue right now? Maybe not. But if you do some overhead presses or any sort of overhead movements, you might have some shoulder issues or neck issues down the road. But once again, we can do something about it. If those muscles are guarding or hypertonic, why not address it before it becomes an issue?
Yeah, 100%. Don't wait till it hurts. I mean, the sooner the better.
Yeah, pain's a good motivator, but it's not the best indicator to the problem, right? So
So many parallels between dentistry and massage therapy. We say the same thing. Like, pain's a great motivator, but if you wait till it hurts, it's usually too late to
right,
save the tooth or whatever.
exactly,
So,
exactly, yeah.
Mhm.
so you had mentioned that you got an internship with the Real.
Mhm.
What type of like um, cross, gosh, what's the word I'm trying to use here? Integrative practices with other professionals. So not just massage therapists, because you work with Dr. Alex as well, correct?
Correct. Yeah.
So describe how that relationship is and what that looks like professionally.
Of course. Yeah. So with Dr. Alec, he's a naturopath. He has obviously a wider scope of what he can do. And one of the quotes that I like to repeat is that I'm good, but I'm not God. So there is some cases that I might not be able to help you with what you have going on. Maybe we can prevent it from getting worse, but there's cases where I might refer out to Dr. Alec for some PRP injections or platelet-rich plasma to help restore the tissues from within. Um, so yeah, as far as like the connections that I have a podiatrist up at the U. I also work with the University of Utah with oncology patients. A lot of not just naturopaths, but there's another one. I can't remember what her title is, but she's amazing. So anytime I run into an issue like that, I'll refer to obviously somebody with that level of expertise. I'd love to share a story where I
Yes.
had that realization. I had a patient that came in with sciatic pain, and sure enough, I did all the protocol and my general assessments and whatnot, and everything turned out that yeah, the muscles that are typically off are off. We would work on them, and then the next time I saw him, they were off again, which is rare. I said, okay, we'll try it again. We worked on the same muscles. Following week, they were off again. That's where I was like, okay, something else is going on here. This is beyond me. This is maybe a little bit more complicated than what I can do. So I said, tell your physical therapist, because he was also going to physical therapy, tell your physical therapist that you need an MRI. I can't prescribe it for you, but maybe through him you can get it. The next time I saw him, he said, my physical therapist says that sciatica takes time and that we're just going to continue with the exercises. And I told him, no, there's something else going on. Trust me. I trust my pattern so much that I knew something else was going on. Well, a couple weeks later, he finally got the MRI, and it turned out he had a grade 2 tumor growing in his spine, in the lumbar spine. So that tumor was obstructing the neurological connection to those muscles, creating some sciatic like type pain. So it was bittersweet. Obviously, I didn't want to hear that coming from a patient of mine, but I said, okay, well, obviously you got to take care of it. The the surgery was done that same day. I asked him, how's that sciatic pain? He said, I don't feel it. I don't have sciatica anymore. I was like, okay, well, maybe it's because of the surgery, the anesthesia, whatever. Let's wait a couple days. He hasn't had sciatica for over a year. So that issue in his spine was creating sciatic like pain to where I would address the muscles that typically would help with sciatica. I ran into a roadblock where that same issue was coming back. I knew something else was going on. So there's definitely cases where I tell patients, look, I'm good, but I'm not God. There might be something that I can't help you with, but I definitely have the resources to refer you out. And I'd love to have that connection, because the more tools we have under our belt, the less likelihood we'll treat every case the same. Does that make sense?
100%.
Yeah.
Again, so many parallels between
Yeah.
what you do in hygiene, where we'll see a patient, and I mean, everybody likes to say, oh my, if we see bleeding, they're like, oh, I just have sensitive gums. And it's like, yeah, there's more going on here than just bleeding gums. Like, I actually just had a patient on Thursday. She's a regular 3-month recall patient, and I was like, you are bleeding a lot. Are you okay? Like, have you been stressed? And she just kind of started pouring out a story, but she was telling me that her insurance quit covering her diabetic medication. So her doctor suggested that she let her blood sugar go up, so that way insurance would see that she needs that medication. And
Wow.
it has thrown off everything for her.
Yeah.
So she was a bloody mess. I mean, obviously that's not the same level as what you were doing there, Edgar, but just those things that we see when we know something's not right here.
For sure.
This is more than just, oh, I forgot to floss, I have bloody gums. When you
Right.
see that those patterns of what you do, just something is not the same, you have to look at the whole body more than just like your specific scope. There's something bigger going on here.
Right.
And so that's definitely something I respect largely about your field and your approach and your practice.
Right.
Amanda, I'm thinking about when we find a lesion in the mouth, and we just, our heart and gut just tell us like, no, that is not right. You need to go get a biopsy, and then they'll come back with some type of oral cancer.
Yeah.
But when you get that gut feeling, you're like, oh, I know this is not right.
Right.
Yeah, I think that's definitely a good marker of a healthcare provider, like somebody that's in tuned. And I think you were talking about this a couple weeks ago, Joffrey, like being present and not just being on autopilot. Because Edgar, in your line of work, I couldn't imagine you not being present. Like with how you work, like you are working in so many levels. You have got to be picturing everything that you're doing with your hands. And I mean, the same in hygiene, like it's, we could probably zone out a little bit easier than you, but not being present, there's so much that you can miss as a provider in
Right.
not being engaged and thinking about things 100%.
For sure. Yeah. You said there's so many layers. I feel like it's like a matrix inside our body, because of the fascial layers, the muscle layers. Even with my approach, like in massage therapy, there's what we call energy work, right? So there's modalities out there where they don't even touch the body, right? And once again, there's a time and a place for everything. But how have you guys ever heard of Reiki? Reiki massage? Yeah. Have you ever had a session in Reiki?
I've never had Reiki. I don't fully know what it is, but I have heard of it.
Yeah. So it's definitely more like Eastern medicine, and it's definitely a lot of energy work and whatnot. And some patients rave it, some patients love it. But with what I do, since I'm working on so many layers, I feel that there is some sort of energy work behind it as well, because I always question myself if I'm working on the, let's say, the traps, the upper trap, it's the most superficial layer there. How come it doesn't also affect the splenius capitis, which is a lot deeper in there, or the multifidi of the cervical spine? But I feel that being present and consciously thinking of the muscle in some weird metaphysical way changes that. So as far as being present, I have to be, because I'm literally envisioning which muscle I'm trying to work on. And it's weird because I'll do the assessments and do the tests, and you can distinguish the results based off of those tests. Like, oh, I worked on the trap and the assessment comes out positive where it's now restored. Then we address the splenius capitis and it's not. So it's kind of a weird concept that I have, that there is some sort of energy work behind it, because you have to vividly picture those muscles and definitely be present the whole time.
Okay, Edgar, here, this is just another parallel with dental hygiene, because if somebody has like bone loss, right? And we are cleaning between the tooth and the gum where we can't see. We are literally just cleaning around the root of the tooth with like just by feel. Like, what does it feel like? You know, we know the shape of that tooth, the morphology of it. But we can't see what we're cleaning. We just have to like use our tactile sensitivity to get in there and get it out. Like, if you're not paying attention, you're not going to get it all.
Miss it easily.
That's cool. Yeah, there's so many parallels.
So many different impacts, though.
Mm-hmm.
So what have been some of the biggest challenges in your career, going from starting out, you know, not even thinking about massage therapy as a career, to going to school, to getting your internship, to where you are now? What were the biggest challenges that you faced?
So, I mean, if we go back, like in the beginning, going back to burnout, right? Because you mentioned something about burnout. Um, I did experience that like the first year or 2 years, but it wasn't so much physical. It was more emotional. It was more like every time I got a patient in that was suffering and a lot of pain, it almost seemed like I was absorbing their pain, absorbing their problems and their issues. So that was one obstacle that I had to figure out how to fix. Eventually, rather than absorbing, I decided that I needed to observe. Rather than absorb, I got to observe. I got to observe this case because this case is going to help me for the next patient that comes in with maybe a bigger problem. And after dealing with so many people, like there is some psychology aspect to it that pain is attached to. So that helped me understand, like, okay, this patient is here for the next hour, hour and a half. I can't maybe fix their problems completely, but I'm going to do everything I can to make them at least feel better than when they came in. So that was one obstacle that I had to detach myself from, that I wasn't going to absorb their problems, but rather I needed to observe and learn from this patient. And so that's been my motto with every patient that I work with. I'm going to learn something new.
That's a huge takeaway. Sorry, like, not to take away from that moment, but like that's, I mean, that applies to any profession. That is incredibly profound. Like the fact that you kind of stopped and like noticed that, walked away and solved a problem like that, that's huge, Edgar.
Because like I said, I was burned out emotionally. I was like, this isn't like hard on my body. I left to work out. I left to be, active. So it wasn't much physical. But at the end of the day, I just felt drained. And so I had to figure out, well, why am I feeling this way? And then I realized, oh, it's because I'm putting so much emotional energy behind this that I'm left drained at the end. And one of the best metaphor that I have is that a candle loses nothing by lighting up another candle or 1,000 candles, right? And eventually, we're not going to live forever. This candle's going to run out at some point, but I want to light up as many candles as I can while I'm here. So that was something that I needed to take, that the energy that I have is mine. The energy that patient has is theirs, but we can work together to figure out a solution to their problem. So that was definitely an obstacle in the beginning.
I have a question. Yeah. When you were in the middle of that like burnout, did you ever consider, okay, I need to do something else? Or were you like, no, I'm going to find a solution?
Well, to get a little personal, I was also going through a divorce, my divorce. So, and I had 2 little boys at the time. So it was really draining from both angles, right?
Yeah.
And then I had to realize I'm doing a disservice by bringing my baggage into this. So I learned from that point forward, when I'm on this, in this room with this patient, I'm here for them. Forget what I'm going through, because if I'm carrying this with me, the results weren't the same. I felt like it was a disservice to that patient because I wasn't fully present and I wasn't fully there. So what was your question again? Sorry.
Did you ever consider like leaving the field?
The reason why I bring that up is because I said, okay, I'm going through a divorce. I'm going to need to make some more money. Maybe I should go work in construction or go do oil rigs. And I literally thought about that for a second. It was a crossroads. I'm glad I didn't, because it's paid off. But definitely that time in my life was a little bit more stressed out or more chaotic than it is now. But that taught me to handle other situations that might be even worse than what I went through, because you never know what you could go through. But as far as detaching myself from what I'm going through outside of these doors, was the best thing I could do. As far as learning how to detach myself from that patient as well was the best thing I could do, and I could just focus on, helping.
What would you say your like key there in being able to detach from a patient, say it was unsuccessful, or even if it was successful, what is it for you that helps you to detach from like their energy, their emotions that you were feeling?
Listening, just listening to the person, listening to the patient, um, empathy, rather than having sympathy and feeling sorry for that patient. I want to have empathy and put myself in their shoes. What would I do if I was in their shoes? Kind of funny with my mom too. She's suffered from shoulder issues and low back issues. So I would always look at a patient and be like, if this was my mom here right now, what would I do for her? So having empathy is one way that I do it. I think gratitude, just being thankful that this patient has enough trust in me to see if I can help them out. Gratitude enough to say I'm going to learn something from this patient right now. So I would say empathy and gratitude are the main things that I use to apply that.
I love that perspective. I think gratitude goes a long, long way in just putting you in the best mental place that you can possibly be.
Right.
So, that's phenomenal.
Edgar, you mentioned like you absorbed their energy and then you made that switch to starting just to observe it. And that really just resonated because as the provider, when we're dealing with our patients, there comes like a times where you accidentally absorb it, like you didn't even want to, or those were not your intentions. I had a teenage girl who had these braces on, and her gums were just overgrowing the brackets. It was just very challenging to take care of her, and it was so painful to touch those gums. So I'm like, listen, we really need to get your gums numb so that I can clean this so we can get it better. And the little girl, teenage girl, she's just like so scared of the needle and tears rolling down her face. And all I could think of was like, oh my gosh, you're almost the same age as my daughter. Like I would feel so sad if this was my daughter right now, like who's terrified but in such a bad condition, like you have to fix it, you have to do it. But oh my gosh, just her tears just like breaking me emotionally. I was just like, oh, you sweetheart, I'm so sorry we have to do this. But then I was like literally drained for the rest of the day because I just like took too much of her energy in.
Right.
So you don't want it to happen, but sometimes it just sneaks up on you.
Right. Yeah, definitely. Um, I think there's a seed of positivity in anything. I think one way that you could look at it is using her story. How could we prevent or at least add a layer of protection from that happening to somebody else? So that's one way that I could look at that situation. Like, so I don't have to see more people go through what she went through. What preventative measures could be taken to not get to that point, if there is any, and if there's not, let's figure them out. There might be a way to prevent that happening to somebody else.
I think we need a world with more of you in it, Edgar.
Yeah, a seed of positivity. Like when your hands give out, you're just gonna write these inspirational quotes for all of us to
genuinely either write a book or you can become a motivational public speaker because be fantastic.
Thank you.
Okay, I'm gonna kind of wrap up with our last two questions, unless there was something specific that you wanted to share with us, Edgar.
No, I mean, I think we've covered. You asked me about my story. You asked me about what got me here. I always tell patients I'm just stubborn. I want to figure things out. I feel like all the answers to the universe can be answered through our bodies, through our minds, through the way that our body functions. So I hope collectively people understand that the more we hear stories like this and the more we get to communicate with one another, the more we realize we're all kind of living in the same flow or the same pattern. And I definitely want people to take some advice, like just learn from every situation, from every patient that you interact with in any field. I think in any job, like you can learn something from everybody that you work with.
I completely agree with that. Yeah, if you're not learning from each situation that you're in, you don't remember it and you don't grow as a person. And I think as a provider, if you're not learning with each of those encounters that you have with a challenge or whatever type of situation, it's an opportunity to learn and grow and just become better. So I think it is important to really be alert, be in like the present, be present, and have those takeaways. So, well, our last two questions, Edgar, because you're our first non-dental person, we had to kind of change these a little bit. Um, what? Well, let me get there. What do you wish you would have learned in school that took you years as a practitioner to learn?
That the word practice, like in a medical practice, massage practice, means just that. It means you have to practice it. You have to apply it. You have to learn. You have to realize that you're never going to stop learning. So definitely use that word practice and apply it every day. Um, Once again, not to bash on the medical field, but I feel like we rely just on the textbook and that's it. And that's all there's going to be. And we forget to learn from everybody, every patient, every case. So that's one thing I wish I would have learned earlier. That way I wouldn't have ran into so many roadblocks or just gave up in some cases. So use that word practice and apply it every day. Not be afraid to not be afraid of the hard challenges either, because there's an answer to everything. It's just a matter of time. It's just a matter of being patient and using all the resources. So definitely understanding that word practice after whatever title you have. Hygienist practice, dental practice, massage therapy practice, medical practice. Keep practicing, because it's going to help somebody out.
All right, Edgar, last one here. What piece of advice do you wish you could go back and give yourself as a new graduate?
What piece of advice? Okay. Dang, that's a good one. Be precise. And I'm looking at my little fountain hand that I have, because it's like running water and it's like holding the two fingers like this. But you have to be precise on what you want out of your career, which I have another story if you guys don't mind hearing. But
let's hear it.
So when I was at massage school, precisely, we were supposed to we wrote a letter to ourselves from 5 years in the future. So basically saying like, hey, you're 5 years in, this is what's going on, right? So in that letter, which I still have, I wrote that I was working with athletes from all over the world, that I was working with football players, because football is my favorite sport, that I ride a helicopter to work, and a few other things. But of course, 5 years later, I'm working with football players, which is soccer, football. And they're from all over the world. There were players from Jamaica, Mexico, the UK. So literally, I basically manifested that, but I wasn't precise about it. So literally, with everything that I do now, I'm very precise as far as like my goals, my affirmations, my visualizations. I'm very precise about what I want. I don't have my helicopter yet, but hopefully one day.
I was just gonna say, I didn't see the helicopter pad on the roof of your building, but I mean, it could be there. It's the coolest building ever.
But you know what? When I go to the U, my view, my window is right at the helipad, right where the helicopters land. I get to see them every time I'm over there, when they land, when they take off, and it's a nice reminder to let me know that that's still in my vision.
That's cool.
Yeah.
I'm glad you shared that with us, Edgar. That was a great way to close this off. Thank you so much for joining us this evening.
So how can somebody find you if they're like, hey, this sounds like something I need, I'm ready to try Edgar's style of massage therapy? How can our listeners find you, Edgar?
Yeah, and I don't know how broad your guys' audience is, but I have people that fly in for a week and a half to take care of some of the issues that they have going on. So that's open to the public. But My website's NeuroMuscleWorks, all one word together, neuromuscleworks.com. I have a small Instagram page, NeuroMuscleWorks as well. If people want to follow me on my personal page, which I have a pretty good following on that, that's Eddie27 ONE or one. So Eddie271. I post quite a bit on that as well, as far as what I do here and the athletes that I work with. But yeah, if people want to reach out through neuromuscleworks.com or find me through the Instagram or Facebook. I don't think I have well, actually I do have a Facebook, but that's all in Spanish. So if you guys speak Spanish, you guys can follow me there. But my Instagram is in English and my website's in English as well.
And you're also on LinkedIn.
I am, yeah. So that's also a small following. I'm not as active on there as I should be, but I'm definitely on LinkedIn as well.
Well, I have not followed you on Instagram yet, so look for new followers.
For sure.
Cool. Well, thank you so much, Edgar.
Thank you.
I appreciate your time, and I hope you have a great weekend with your families.
Likewise.